If you've been told that improving your sexual health, size, or confidence after 60 is impossible, you've been misinformed. Aging doesn't mean decline. It means adapting with smarter, science-backed strategies tailored to your body's evolving needs. I'm Dr. James Carter, a board-certified urologist with over 25 years of experience helping thousands of men rediscover their vitality, strength, and sense of self naturally, without risky surgeries or questionable supplements. Today, I'm sharing 4 proven strategies to enhance penile length, erection quality, and overall performance, specifically designed for men over 60 navigating post-retirement changes, health challenges like prostate issues, or simply a desire to feel like their strongest selves again. The 4th strategy is a surprising cornerstone that can transform not just your physical health, but your entire outlook, requiring as little as 10 minutes a day. These strategies are interconnected, building a holistic foundation for lasting change: physical, emotional, and relational. Each method draws from cutting-edge research and real patient success stories, ensuring you have practical, actionable steps to take control. Before we dive in, hit subscribe and turn on notifications to receive weekly men's health tips crafted for you. Comment 1 if this resonates with you, or 0 with feedback to help me serve you better. Let's explore these 4 strategies in reverse order, starting with the most transformative, to help you reclaim your strength, dignity, and confidence today. Some of you might be skeptical, thinking, "I'm too old for this," or "I've tried things before and they didn't work." I hear you, but let me assure you, your body is still capable of remarkable change, no matter your age. The key is consistency, awareness, and the right approach. Stay with me, and I'll show you how to unlock your potential, step by step. Strategy 4. Rewire your mindset, the emotional foundation for growth. Many men over 60 carry a silent burden, feeling that aging has dimmed their spark or masculinity. A 68-year-old patient, John, came to me saying, "Dr. Carter, I don't feel like a man anymore." His words struck a chord because they reflect a truth I've seen in countless men. Your mindset shapes your outcomes as much as, if not more than, your physical efforts. Shame, silence, or isolation around sexual health can erode confidence, creating a cycle of frustration and disconnection. But addressing these emotions head-on is transformative. It's the bedrock of any physical progress. John was terrified to discuss his struggles, fearing judgment from his wife of 35 years. I encouraged him to start small, saying, "Try telling her, 'I'm working on feeling stronger and I'd love your support.'" 1 week later, he returned, beaming. She said, "I'm with you no matter what." And that changed everything, he told me. That single conversation gave him the courage to commit to other strategies, amplifying his physical results. A 2020 study in the Journal of Sexual Medicine found that reducing psychological stress improves sexual function and responsiveness to physical therapies by up to 40%. Another study in Psychoneuroendocrinology, 2018, shows that chronic stress elevates cortisol, which suppresses testosterone and hinders tissue repair, making mindset shifts critical. The societal pressure to perform as you did in your 20s can fuel anxiety or avoidance, but reframing your narrative from "I'm broken" to "I'm taking charge" unlocks potential. Another patient, Robert, 71, felt isolated until he joined a men's health group online. "Hearing other men's stories made me realize I'm not alone," he said. After 4 months of mindset work, he reported not just physical gains, but a renewed sense of purpose. "I walk taller, and my wife says I'm more engaged," he shared. Your mind drives your body, empower it, and the rest follows. Why it matters. Psychological barriers often stem from internalized stigma or fear of vulnerability. Men may avoid discussing sexual health, assuming it's just aging or fearing embarrassment. Yet, openness fosters connection and motivation. A 2019 Frontiers in Psychology study found that positive affirmations and social support increase adherence to health goals by 30%. By addressing shame, you create a positive feedback loop. A stronger mindset reduces stress, enhances physical results, and boosts confidence, which further fuels your commitment. How to practice. Journaling, 5 to 10 minutes daily. Write one thing you're proud of. For example, I chose a healthy meal today. And one health goal. For example, I'll walk 20 minutes tomorrow. Use a private notebook or apps like Day One or Notion for security. Journaling builds self-awareness and tracks progress, helping you stay motivated. Open communication. Start with a simple phrase, "I'm working on feeling stronger and could use your support." Practice with a trusted friend if a partner isn't an option. Apps like BetterHelp or Talkspace connect you with licensed therapists. Discreetly sessions start at $60 a week. Affirmations. Spend 2 to 3 minutes daily repeating, "I am capable of growth at any age," or "My health is worth my effort." Record them on your phone for daily reminders. Affirmations rewire self-doubt, per Frontiers in Psychology, 2019. Support groups. Join online communities like Men's Health Network, menshealthnetwork.org, or Reddit's Men's Health for Anonymous Discussions. Local senior centers may offer men's groups check community boards or aarp.org. Mindfulness practices. Try 5 to 10 Inuit guided meditations via Headspace or Calm to reduce stress. Focus on breathing or body scans to stay present. A 2021 Journal of Clinical Psychology study shows mindfulness improves sexual satisfaction by 25%. Address objections. If you're thinking, talking feels awkward, start small. Write a letter to your partner or practice with a therapist. Vulnerability takes practice, but builds strength. Patient story. Robert, after joining a support group and journaling daily, saw not only physical improvements, but a shift in perspective. "I used to hide my worries, but now I feel like I'm growing, not shrinking," he said. John's wife became his biggest cheerleader, reinforcing his efforts. Your mindset is the foundation. Start building it today. Strategy 3. Optimize your body. Sleep, weight, and circulation. A 65-year-old patient, Mark, came to me frustrated. He'd been trying stretching exercises for weeks, but saw no results. "Dr. Carter, I'm doing everything right. Why isn't it working?" he asked. When I probed, he revealed he slept only 4 to 5 hours nightly, carried 25 extra pounds, and smoked occasionally. Lifestyle factor. Sleep, weight management, and cardiovascular health are the foundation for any enhancement strategy. Without them, your body lacks the environment to thrive. Sleep is critical. 7 to 8 hours nightly boosts testosterone and growth hormone, essential for tissue repair and sexual health, per a 2019 Sleep Medicine Reviews study. Poor sleep disrupts hormone balance, reducing penile tissue responsiveness by up to 20%. Excess abdominal fat can hide 1 to 2 inches of penile length by covering the base, a condition called buried penis syndrome. A 2020 Obesity Reviews study notes that visceral fat increases estrogen, further lowering testosterone and impacting erection quality. Cardiovascular health is equally vital. Erections rely on robust blood flow and clogged arteries from smoking, poor diet, or sedentary habits limit results, as highlighted in the referenced video's focus on vascular damage from prolonged sitting or biking. Mark committed to a consistent bedtime, avoiding screens an hour before bed, and adopted a Mediterranean diet rich in vegetables, broccoli, spinach, lean proteins, chicken, fish, and healthy fats, olive oil, avocados. He started walking 30 minutes daily, used nicotine patches to quit smoking, and drank more water. After 10 weeks, he lost 12 pounds, noticed stronger erections, and saw a longer appearance. My wife noticed before I did, and it boosted my confidence, he smiled. Another patient, Alan, 68, added swimming to his routine and cut processed sugars. I feel like I'm 50 again, he said after 3 months. The referenced video emphasizes how lifestyle choices like prolonged sitting compress pelvic nerves, reducing sensitivity. Similarly, optimizing your body creates a ripple effect, enhancing all strategies. For example, losing weight not only reveals length, but improves testosterone response, making exercises like stretching more effective. Why it matters. Aging compounds lifestyle issues. Smoking damages blood vessels, reducing penile blood flow by 30% per the American Journal of Cardiology, 2017. Excess weight and poor sleep suppress hormones, while inactivity weakens circulation. Addressing these creates a body primed for growth and recovery. How to optimize. Sleep 7 to 8 hours. Create a wind-down routine. Dim lights, read a physical book, or listen to calming music. Use blackout curtains, a sleep mask, or white noise machines. If snoring or frequent waking occurs, consult a doctor for a sleep apnea test, which affects 20% of men over 60, per Sleep Medicine, 2020. Weight management. Adopt a Mediterranean diet. Aim for 5 servings of vegetables daily, 2 to 3 servings of lean protein, for example, salmon, turkey, and healthy fats like olive oil or nuts. Use apps like MyFitnessPal or Chronometer to track calories, targeting a 500 calorie daily deficit for 1 to 2 pounds monthly loss. Exercise. Walk briskly for 30 minutes daily, or try low-impact options like swimming or yoga for circulation. Aim for 150 minutes of moderate exercise weekly, per American Heart Association guidelines. Apps like Fitbit can track steps and heart rate. Limit toxins. Reduce alcohol to 1 to 2 drinks daily. For example, red wine for resveratrol. Quit smoking with nicotine patches, gum, or support from smokefree.gov. Counseling doubles quit rates, per nicotine and tobacco research, 2019. Hydration and nutrition. Drink 8 to 10 cups of water daily to support metabolism. Add zinc-rich foods, oysters, pumpkin seeds, 15 to 30 milligrams daily, and vitamin D, salmon, fortified milk, or 2000 IU supplements to boost testosterone. Address objections. If you think, I don't have time, start small 10-minute walks or swapping soda for water. Small changes compound over time. Patient story. Mark's transformation was profound. After 4 months, he lost 15 pounds, slept better, and reported stronger erections. "I didn't realize how much my habits were holding me back," he said. Alan's swimming routine not only improved his health, but rekindled his relationship. These changes aren't glamorous, but create a foundation for thriving. Strategy 2. Avoid harmful habits. Protect your penile health. Inspired by the referenced video's focus on harmful masturbation habits, many men unknowingly sabotage their sexual health through techniques that desensitize or injure. Tom, a 70-year-old patient, struggled with sensitivity. "It takes too much effort to feel anything now," he admitted. Habits like the death grip, overly tight, fast masturbation, or prone masturbation, pressing against a mattress or pillow, train the body to respond only to intense, unnatural stimulation, making intimacy with a partner feel dull or unresponsive. A 2021 urology study found that 60% of men over 60 experience reduced sensitivity from such habits, echoing Dr. Mohit's warning about traumatic masturbation syndrome. Worse, aggressive techniques risk physical damage. Repeated force can cause micro tears in penile tissue, leading to scar tissue or Peyronie's disease, a condition causing painful curvature during erections, per a 2019 The Journal of Sexual Medicine study. The referenced video highlights penile fractures ruptures in the tunica albuginea from forceful bending, often during aggressive masturbation, requiring surgical repair. Tom narrowly avoided this, saying, "I didn't realize how rough I was being." By pausing masturbation for 3 weeks and switching to gentler, lubricated techniques, he regained sensation in 12 weeks. "I feel connected to my wife again," he shared. Lifestyle habits also contribute, as noted in the referenced video. Prolonged sitting or biking compresses pelvic nerves, reducing sensitivity by up to 25%, per a 2018 Journal of Sexual Medicine study. Medications like antidepressants or blood pressure drugs, common in men over 60, can further dull sensation, as Dr. Mohit points out. Awareness and adjustment are key to reversing this damage and protecting long-term health. Why it matters. Harmful habits rewire neural pathways, reducing responsiveness to natural intimacy. Physical injuries like Peyronie's or fractures can be debilitating, with 10% of men over 60 affected by Peyronie's, per Urology, 2020. Lifestyle factors compound these issues, but they're reversible with mindful changes. How to fix. Take a break. Pause masturbation for 2 to 4 weeks to reset neural sensitivity. A 2020 sexual medicine study shows this reset restores nerve function in 70% of men. Use lubrication. Apply water-based lubricants, for example, Kentucky Jelly, Astroglide, to mimic natural intimacy and reduce friction. Start with a small amount, reapplying as needed. Gentle techniques. Ease grip and speed. Avoid prone positions or firm surfaces. Use imagination or sensual music instead of porn to reconnect with natural arousal. Sensate focus for couples. Practice non-sexual touch with a partner, for example, 10-minute back massages, to rebuild intimacy without pressure. A therapist or resources like sextherapy.com can guide this. Lifestyle adjustments. Limit sitting to 1-hour intervals. Stand or walk briefly. For cyclists, use padded seats or take breaks every 20 minutes. Discuss medication side effects with your doctor. Alternatives may reduce sexual impact. Address objections. If you think this feels restrictive, focus on the goal: better intimacy and health. Start with one change, like using lubricant, and build from there. Patient story. Tom's shift to mindful habits restored sensation and confidence. "My wife and I laugh more, know it's like we're dating again," he said. Another patient, Steve, 66, stopped prone masturbation and noticed improved responsiveness in 2 months. Protecting your penile health is critical for all strategies to succeed. Strategy 1. Pelvic floor exercises and stretching. Build strength naturally. David, a 69-year-old patient post-prostate surgery, felt disconnected from his body. "It's like part of me is gone," he said. Pelvic floor exercises, Kegels, and gentle penile stretching changed that. Pelvic muscles, like the bulbocavernosus and ischiocavernosus, support erection strength, stamina, and prevent turtling, retraction when flaccid, a common issue post-surgery or with age. Stretching promotes tissue growth via mechanotransduction, similar to muscle building after exercise. A 2021 andrology study found that consistent stretching increases length by 0.5 -1 inch over 12 weeks, while Kegels improve rigidity in 70% of older men per a 2021 urology study. David learned Kegels by stopping his urine stream mid-flow to identify the muscles. He paired this with daily stretches, warming up with a towel for 5 minutes, then gently pulling outward for 30 to 40 seconds in 4 directions: up, down, left, right. After 12 weeks, he reported firmer erections, better urinary control, and a forward flaccid appearance. "I'm in charge of my body again," he said. Another patient, Paul, 72, added Kegels to his morning routine and noticed stronger erections in 8 weeks. Unlike the referenced video's focus on avoiding harmful habits, these proactive exercises empower men to build strength naturally, complementing lifestyle and mindset changes. Why it matters. Weak pelvic muscles, common after prostate surgery or sedentary lifestyles, reduce blood flow and rigidity. Stretching stimulates cellular growth, enhancing visible length and confidence. These low-cost, equipment-free exercises are accessible and amplify other strategies' effects. How to practice. Kegels. Locate pelvic muscles by stopping urine flow. Practice 2 to 3 times to confirm, then avoid during urination. Contract for 5 to 7 seconds, relax for 5, repeat 15 times, 2 to 3x daily. Add quick flicks, 1-second contractions, 10 reps, for variety. Use apps like Kegel Trainer or Pelvic Floor First for guided exercises. Stretching. Apply a warm towel or heating pad for 5 to 7 minutes to boost blood flow. Grip gently behind the glands, stretch slowly outward or in one direction, up, down, left, right, for 30 to 40 seconds, 2 to 3 sets daily. Avoid pain. Use gentle pressure. A warm shower can replace the towel. Track progress. Log sessions and measurements, flaccid and erect, in a journal or app like Evernote. Expect 0.5 - 1 centimeter gains monthly with consistency. Safety. Stop if discomfort occurs. Rest a day if needed. Consult a urologist for conditions like Peyronie's disease or post-surgical concerns. Combine with lifestyle. Pair with strategy 3, for example, walking, diet, to enhance blood flow and tissue response. Address objections. If you think, this sounds too simple, Know that small, consistent efforts yield results. Start with 5-minute sessions to build the habit. Patient story. David's dedication led to a 0.8-inch gain and improved confidence. It's not about size, it's about feeling whole, he said. Paul's wife noticed his improved presence, saying, "You're more engaged in everything." These exercises are the foundation for lasting growth. Conclusion. Your journey to vitality starts now. A 67-year-old patient, James, told me, "Dr. Carter, I'm not young, but I feel powerful again." That's the heart of this work, not chasing youth, but embracing vitality at any age. These 4 strategies, rewiring your mindset, optimizing your lifestyle, avoiding harmful habits, and building strength through pelvic exercises and stretching, offer a science-backed path to confidence, performance, and connection. Unlike the frustration of declining sensitivity described in the referenced video, these methods empower you to take control, addressing both physical and emotional barriers. Your body is still capable. Start with one small step. Try Kegels while brushing your teeth, take a 20-minute walk, or have an honest conversation with a loved one. Results take weeks, not days, but they're real and sustainable. You're not aiming for perfection, you're claiming presence and strength. Doubt may creep in saying, "I'm too old," or "It's too late." But every patient I've shared, John, Mark, Tom, David, and James, proved it's never too late. Your best years of intimacy and confidence may still be ahead. Join the community. Healing is stronger together. Hit subscribe, comment 1 if inspired, or 0 with feedback to help me improve. Which strategy will you try first? Share in the comments and connect with others on this journey. Visit men'shealthnetwork.org for resources or betterhelp.com for professional support. Check my playlist for more men's health tips, and let's keep this conversation going. You deserve to feel powerful. Start today.